For my first topic regarding gun violence, my claim is the most effective way to significantly reduce gun-related deaths in America is by implementing universal background checks and red flag laws, not by installing metal detectors or arming teachers. Gun violence in the U.S. is uniquely severe, with over 48,000 people dying from firearms in 2022. This level of violence is not matched by any other high-income nation. Metal detectors do not address the core problem: the easy access many individuals, especially those in crisis, have to guns. Increasing armed security or arming teachers escalates the risk of accidental shootings and can turn schools into militarized spaces. Research shows that more guns in schools do not prevent shootings. Instead, they increase the chances of misfires and mistaken identity accidents. The root problem in the U.S. still lacks universal background checks at the federal level, and red flag laws are inconsistent across states. Dangerous individuals can legally purchase weapons because the system is full of gaps. Universal background checks and red flag laws reduce violence by keeping guns away from high-risk individuals while still protecting lawful gun ownership. This approach preserves the learning environment, avoids creating a prison-like atmosphere in schools, and targets the actual case of gun deaths access. For my second response regarding healthcare, my claim was the U.S. federal government should provide universal healthcare because healthcare is a human right, and the current system leaves millions uninsured and prevents people from seeking life-saving care. The U.S. has the highest healthcare costs in the world, but poorer health outcomes than many countries with universal coverage. Millions avoid medical treatment due to cost, leading to preventable deaths and chronic illness. Without this universal healthcare, health disparities, especially for low-income communities and communities of color, continue to widen. People with treatable conditions often become sicker simply because they cannot afford care. The U.S. relies on a market-based system driven by profit and not by access. Insurance companies deny claims, set high premiums, and limit treatment options. This structure inherently blocks equal access to care. Universal health care improves outcomes, expands access, and reduces long-term health care costs by focusing on prevention. Other nations like Canada and the UK show that government-funded systems can improve equity and public health. Innovation does not stop under universal health care. The pharmaceutical and biotech industries in these countries remain strong. A U.S. system could still place limits covering necessary care, but excluding expenses like elective cosmetic surgery. And for my final response regarding drug policy, my claim is the government should establish safe consumption sites because harm reduction is the only proven method that reduces overdose deaths and connects people to treatment. These overdose deaths continue to rise, with fentanyl now the leading cause. Traditional war on drugs punishments have failed to reduce addiction or overdoses. Criminalization alone pushes drug use into unsafe and hidden environments. Without safe spaces, drug use occurs in public areas, increasing disease transmission, emergency calls, and deaths. Communities pay the cost through overwhelmed emergency services and rising homelessness. Current policies focusing on punishment instead of treatment. Resources are pushed into policing instead of prevention, and people who use drugs receive little support for recovery. With safe consumption sites, reduced overdose deaths, lower disease transmissions, and move drug use off the streets will connect people to rehab programs overall. Countries like Canada, Portugal, and Australia show that harm reduction saves lives and lowers community costs. Addiction is a health issue, and these programs treat it as one rather than a moral failure.